I'm Dr. Matt Brengman. I'm going to talk to you about laparoscopic gastric bypass. Gastric bypass is an operation that's been around for a long time. Many people have some experience with gastric bypass, whether it's a family member or a friend that may have had gastric bypass. It's important to note that gastric bypass is not the same today as it was even 5 or 10 years ago, and it's certainly a different operation than was performed 40 years ago. The most important difference is we perform the operation with the video laparoscope, so there's no big incisions, really regardless of size. The operation takes about an hour to an hour and 15 minutes to complete. People are in the hospital overnight and they go home the next day. So really a tremendously different operation than in the past. Gastric bypass's complication rate is about the same as other procedures we do for weight loss surgery. Sleeve gastrectomy, gastric banding, and leads to the most weight loss of all the operations that we perform. We lean more heavily on gastric bypass as a choice in certain patient populations. So if the patient's body mass index gets above 50, that's really, we begin to look at gastric bypass because it leads to more weight loss. We see 65 to 75% of the extra weight being lost after gastric bypass. In addition, the weight loss is probably a little more durable in terms of the long term after gastric bypass. Bypass is also really good for people with certain medical problems. And so gastroesophageal reflux or heartburn is well treated with bypass and potentially is exacerbated by sleeve gastrectomy. And diabetes. We know that bypass is a more effective operation for diabetes than sleeve gastrectomy. So if somebody has severe diabetes, diabetes greater than 8 or 9 years, high doses of insulin, probably bypass is a better intervention for that person than sleeve gastrectomy. There's been some recent information on joint disease and weight loss surgery, including gastric bypass, that one is the joint pain tends to get better even before the weight loss really begins. We think that has something to do with the body's total level of inflammation, which gets quite a bit better after bypass. And then there's the weight loss component, which obviously is going to improve people's joint pain when they ambulate because there's not as much weight on the joint, that cartilage that's been worn down. Weight loss surgery before joint replacement is really important. It decreases complications, including infections, and it leads to better long-term outcomes with joints. There's also an alteration in the way people walk after weight loss surgery. Walking is greatly altered by additional weight to try to support the weight that occurs above the hips. And as that goes back to normal, the joints function more normally. And so some of the pain associated with weight goes away because the stress points have changed. So when we do a gastric bypass, we're going to really change the way the food goes through the gastrointestinal tract. So the stomach, which is normally a big bag and holds about 1.5 liters, we're going to make a small pouch out of that that holds really 2 to 3 ounces. We're also going to rearrange the intestines slightly so the food goes directly into the second portion of the intestine rather than going through the stomach. This leads to all kinds of alterations in how a patient feels after they eat. First of all, there's a small pouch. So a small amount of food fills a small pouch. Patient feels satisfied with a small meal. But maybe even more important is that the food now is going to go from this small stomach pouch directly into the second portion of the intestine. And that's not the normal way. Normally the food goes into the stomach and it hangs around for a little while. And it's changed. It's processed before it gets to the first portion of the intestine. So when it goes into the intestine unchanged, the body senses that. And the body starts to produce a whole bunch of gastrointestinal hormones that have effects on the body. One of those effects is a strong suppression of hunger. so that people don't get hungry during the day. And that effect lasts for about a year. So we see a situation where patients don't really get hungry to eat. And when they do eat, they're very comfortable with a small amount of food. Because of that, patients can take in very small numbers of calories over the first 6 to 8 months after the operation and lose a tremendous amount of weight.